Welcome to this video, where we'll be discussing orbital cellulitis, a serious infection affecting the tissues surrounding the eye. It's important to understand this condition, its causes, and how it's treated to ensure prompt medical attention when needed. Orbital cellulitis is most commonly caused by a bacterial infection that spreads from nearby sinuses, particularly the ethmoid and maxillary sinuses. Other causes include infections spreading from the teeth, skin, or middle ear. Less frequently, it can result from trauma to the eye socket, such as a fracture or surgery. The most common bacteria responsible are Staphylococcus aureus, Streptococcus pneumonia, and Haemophilus influenzae, although the specific bacteria may vary depending on the patient's age and medical history. The pathophysiology of orbital cellulitis involves the invasion and inflammation of the soft tissues around the eye socket, or orbit. Bacteria enter the orbit, leading to an inflammatory response. This inflammation causes swelling, redness, and pain in the affected area. As the infection progresses, it can lead to complications such as abscess formation, increased pressure within the orbit, and even damage to the optic nerve, potentially causing vision loss. The infection can also spread to the brain, leading to meningitis or cavernous sinus thrombosis, which are life-threatening conditions. Orbital cellulitis is more common in children, particularly those under the age of 9 or 10, but it can affect people of all ages. There isn't necessarily a gender predisposition. Individuals with sinus infections, recent eye injuries, or weakened immune systems are at higher risk. The incidence varies depending on geographic location and access to healthcare. The signs and symptoms of orbital cellulitis can be quite dramatic. Common symptoms include swelling and redness of the eyelids and surrounding tissues. Patients often experience pain around the eye, especially with movement. Other symptoms include proptosis, which is a bulging of the eye, decreased vision or double vision, difficulty moving the eye, fever, and general malaise. In some cases, there may also be headache or lethargy. It's crucial to seek immediate medical attention if any of these symptoms are present. Diagnosing orbital cellulitis typically involves a thorough physical examination, including an assessment of the patient's vision, eye movement, and pupillary response. Blood tests are usually performed to check for signs of infection. Imaging studies, such as a CT scan or MRI of the orbits and sinuses, are essential to confirm the diagnosis, determine the extent of the infection, and rule out complications like abscess formation. Cultures may be taken from any drainage to identify the specific bacteria causing the infection. While orbital cellulitis is not strictly classified into different types, in the same way as some diseases, it's important to differentiate it from preseptal cellulitis, also known as periorbital cellulitis. Preseptal cellulitis is an infection of the eyelid and skin around the eye, but it does not involve the orbit itself. It's generally less severe than orbital cellulitis. Distinguishing between these two conditions is crucial because their management differs significantly. Treatment of orbital cellulitis requires prompt administration of intravenous antibiotics to combat the bacterial infection. Broad-spectrum antibiotics are typically used initially, and the specific antibiotic may be adjusted based on the results of cultures. In some cases, surgical drainage of any abscesses within the orbit may be necessary. Supportive care such as pain management and monitoring of vision is also important. Close monitoring is essential to watch for complications and ensure the infection is responding to treatment. Preventing orbital cellulitis involves promptly treating sinus infections and other potential sources of infection. Practicing good hygiene, such as frequent hand washing, can help reduce the risk of bacterial infections in general. Protecting the eyes from injury can also help prevent orbital cellulitis resulting from trauma. For individuals with weakened immune systems, careful management of underlying conditions is crucial. With prompt and appropriate treatment, the prognosis for orbital cellulitis is generally good. Most patients make a full recovery without any long-term complications. However, delayed or inadequate treatment can lead to serious complications, including vision loss, meningitis, cavernous sinus thrombosis, and even death. Recent research has focused on improving diagnostic techniques, developing more effective antibiotic regimens, and exploring novel surgical approaches to manage complex cases. Ongoing studies are also investigating the role of inflammation in the pathogenesis of orbital cellulitis to identify potential therapeutic targets.